Good morning, everyone. This is Dr. Vivek here again, a senior consultant working in the Retina Services Department of Shekar Hospital, JP Nagar, Bangalore, on Facebook Live today to talk to you about common age-related eye disorders. So we have a very significant aging population. When we got our independence way back in 1947, the average life expectancy of an Indian man was around 60, 61 years, and a woman was around 54 years. Today, it has jumped by another 20 years. On an average, we will be alive for at least around 74, 75 years of age. So we have a significant aging population, because of which there will be a lot of these age-related disorders which we tend to see more commonly. More people are reaching their 70s, and hence these age-related disorders will be more commonly seen as we go into the future. So what is the next, what are the common age-related eye disorders that we come across? The most common obviously would be a cataract. The next would be glaucoma. Then there is age-related macular degeneration, retinal vascular occlusions, diabetic retinopathy, optic neuropathies, nerve palsies, and many such disorders. But I would be restricting my talk today to age-related retinal disorders. Last week I had talked to you about diabetic retinopathy, so I won't touch on to that topic again. I'll restrict myself to two burning topics today, which are age-related macular degeneration and retinal vascular occlusions. So age-related macular degeneration, as the name itself suggests, it is age-related. So like as we grow older, all of us or most of us are at risk of developing this condition. So it is a leading cause of irreversible blindness in developed countries like in US and Europe. The most common cause of irreversible blindness is age-related macular degeneration, or in short, AMD. It is the third most common cause of blindness in India. So we are not like way back in the 20th century, we used to be like 20 years behind. Now we are not that behind when compared to all kinds of technologies. In fact, in some of the technologies, we are on par or even advanced when compared to the developed countries. So even here, unfortunately, it is becoming more and more commoner. Like when I started reading or learning about this particular disease, it was not very common. Out of 10 retina patients, 2 or 3 of them would be having this issue. Today, out of 10 retina patients that I see, almost 5 or 7 of them will be age-related macular degeneration. That is not because the others have come down and this has increased. It's just that our aging population has increased and all these age-related disorders are becoming commoner. And the worst part about this AMD is that it affects both the eyes in almost 30 to 40% of the people. Like one eye is affected, we can still say, okay, he will take care of it, he or she will take care of it, and one eye is gone, let me live a normal life as much as possible with some limitations, because the other eye is good. But we have seen in my long stay at Shekar Hospital for the last 15 years, that once one eye gets affected, within the next 2 to 3 years, almost 40% of the people develop a problem in the second eye also. So, and when that happens, it is really very, very disturbing and very emotionally challenging to the patient as well as the family which takes care of them. It can cause severe vision loss. It is not like mild disruption in vision wherein you probably limit yourself to a certain extent and then you can still manage to lead your life. It can cause severe visual loss leading to economic and legal blindness. As we see in one of the photographs here, the central vision is lost. So like for example, the most common complaint that a person will come to me with AMD is that when I see my watch, I can only see the edges of the watch or the clock. I cannot see the dials, I cannot see the numbers inside. And if you don't get treated, that black patch keeps increasing and it almost engulfs the whole clock so that you can only see the wall around it and you can't see the clock at all. So that is the kind of disability. So obviously, wherever you see, your vision is blurred. Around that, you can have some amount of vision. So if you want to read something, you are unable to read the letters there. You can see something around it. So that is a very distressing kind of a vision loss. It can also cause lot of distortion in vision, like the second photograph that I've shown you. Everything, whatever the straight lines, like the line around the window pane, which should be straight, appears wavy. The edge of the fridge or the refrigerator at your home, or even the television, appears wavy. So a beautiful looking heroine's face will be contorted. So all these things can cause a lot of distress. So how do you treat macular degeneration? See, the golden point in treatment of macular degeneration is early presentation and early treatment. Like there is a saying, a stitch in time saves nine. Here, an injection in time probably saves nine more. So that same thing applies here as well. So the, the most common treatment for AMD is basically intraocular injections. Of course, in AMD also there are two types. One is called the dry type and the wet type. Dry type is more common. Almost 90% of the cases are dry. 10% are wet type. Dry type don't require injections, but wet type, when they get converted from dry to wet, need injections, and this is the most common treatment. And these two things are very important: timely and regular. So, like, if you, it's not like, okay, today I have been diagnosed with this particular problem. I will take my own sweet time, arrange money. I will finish off my Graha Pravesha or a daughter's marriage or something else. Or I'll take multiple opinions and then I'll come back after 3 months or 6 months and then do the treatment. That is not going to work in your favor, because just like any other retinal disorder, the vision loss that happens is irreversible. Once lost is lost. We can only salvage whatever is present. We can only save whatever is present. Improvement is difficult. So the same thumb rule applies here as well, that timely treatment. Once diagnosed, don't delay the treatment. Go ahead with the treatment straight away. Do not delay it, please. So timely. And after that, it's not going to be a single treatment. In fact, the most common method of treatment right now is to go for 4 weekly. It's not even monthly. It's not even at 31st, 31 days. It's at 28 days. You need to take at least 3 injections as a loading dose. Like that is the initial treatment. Take 3 injections, and then subsequently, based on the response, we can monitor the treatment regimen. So timely and regular. These are the most important. The next comes nutritional supplements. So nutritional supplements in the form of antioxidants and multivitamins and minerals. Basically, these are given to reduce the risk in the second eye. That is, if one eye is affected with wet AMD, the other eye inevitably will have dry AMD. For the second eye, to reduce the risk of developing a wet AMD, we need these nutritional supplements. These don't work on already a wet AMD patient. So that needs to be kept in mind. Nutritional supplements don't work. And why are nutritional supplements necessary? Because generally, vegetarian diet has very little antioxidants and multivitamins, particularly vitamin B12. So these antioxidants, so oxidation is a process where, I mean, oxygen, when it is present, it is necessary, but when it is present and unutilized, it becomes converted into oxygen free radicals, which tends to cause internal damage to the cells, and the cells keep uh, losing themselves. It is called as automatic cell death or apoptosis. So that is one of the most common causes of that. And to improve the level of antioxidants in a vegetarian's body, we need these nutritional supplements. Not that a non-vegetarian who has chicken and mutton will have enough, but even those people should require nutritional supplements, particularly antioxidants, because you never know when they get older, because of malabsorption from the or poor digestion, they might not be able to harness even whatever they consume. Good rich food, whatever they consume, might not be absorbed into the system, which leads to nutritional deficiencies again. In select cases, laser can also be done. Laser is also of two types. One is a conventional laser, and the other one is a photodynamic therapy. Some of them who are listening to might be knowing about this. A photodynamic therapy is a costly laser which might cost you up to around a lakh per sitting, where a special type of light is being projected into the eye after giving an injection. This injection goes and photosensitizes the abnormal structures in the blood vessels in the body, and this goes and selectively burns those abnormal blood vessels, leading to response. This is not done for every case of wet AMD. In select cases, it is advised. So, how do you, I mean, what is the outlook? The outlook is reasonably good. See, it's like I always compare this to a test match where our team is already weak. The best option that is available to us is a draw match. Most often, I mean, we might even lose the match, but we can salvage a draw. How? By continuously trying to defend. If you remember that one particular test match of Gautam Gambhir against New Zealand, he played the whole day without scoring many runs. He was always on the defensive, and he saved the test match for India. So, like that, the striker would be the patient, the non-striker would be the retinologist like me. We keep seeing the patient has to come to us regularly. We'll keep observing. As and when the condition needs an injection or a treatment, we keep giving that. And over the years, like over 4 or 5 years or 6 years, a few injections might be required, but as the time goes on, the number of injections also will keep coming down. But at the end of 5 years, 6 years, when the disease process or the activity subsides or becomes silent, whatever vision we would have saved by then would usually remain. So this is a drawn test match. We are, it's impossible to win the test match, almost impossible. But we can draw the test match if the batsman, that is the patient, and the non-striker, that is myself, are in harmony. We understand our partnership. So this is very important. So that is why I keep telling my patients, it's not going to get over anytime soon, but don't feel bad. You need to be regular, and as and when you come, we can definitely help you out. The other common retinal disorders that we see are called as retinal vascular occlusions. Vascular means blood vessel. What we see in our arms and legs, where we draw injections and give blood and give drugs into the veins. These are the blood vessels. So as you know, there are two types of blood vessels predominantly, arteries and veins. Arteries take the pumped blood from the heart to the various organs of the body, and the veins bring it back to the heart. In between, there are capillaries, which are smaller blood vessels where exchange happens. So we'll restrict our discussion to the arteries and veins. So the first image what we see here is that of a central retinal artery occlusion. That is why the whole retina looks pale. In fact, there should be two blood vessels over here. We can only see one. That is the vein which is still intact, and the whole retina is pale. This is an artery occlusion. Whereas this is the second image is the central retinal vein occlusion, where this is the optic nerve, which is the central part of the eye or the retina, from where the blood vessels either enter into the eye or exit. Enter in terms of artery and exit in terms of vein. So there is a block right in the center here, and because of which there are hemorrhages all over, that is bleeding all over, and this is called as a central retinal vein occlusion. Whereas the third image is a branch retinal vein occlusion, one part of the branch. Okay, see, this vein is quite intact, healthy, normal. This vein is also fine, this is also fine. Whereas this vein over here has blocked, because of which there is led to increase in back pressure and bleeding and swelling in the retina. So what are how to detect these illnesses? The, the best way to is to examination. I mean, many people who might have visited our hospital might have seen that we examine the patients in various ways, either on this, this instrument called a slit lamp, or on indirect ophthalmoscopy. And then subsequently, if necessary, fluorescein angiogram and OCT are done. So what are the causes for these retinal vascular occlusions? The causes for retinal vascular occlusion, there are no specific direct causes. Generally in the elderly, they are what are called as risk factors. The risk factors being aging, hypertension or blood pressure, high blood pressure, then hypercholesterolemia or high cholesterol levels, then comes diabetes, smoking. All these things are risk factors. There are no specific causative factors where you say, okay, this causes retinal vascular occlusion. There is no direct cause like that. They are all risk factors. So obviously, see, there are some modifiable and some non-modifiable risk factors. The modifiable are smoking, you can definitely cessate; alcohol, you can stop; cholesterol, you can control; blood pressure, you can manage. What you cannot modify, non-modifiable is age. We can't go back in age. We can't go back in time. So someone asked me, what is the best way to deal with this problem? I said, go back 5 years, which is not possible. So, but not to lose heart. I mean, we can manage these patients with, again, injections, laser, and other such things. So, the most important thing is to control the blood pressure, lead a healthy lifestyle, exercise regularly, which itself will reduce the blood pressure, particularly the diastolic blood pressure comes down with a healthy lifestyle, less of salt in the diet, less of oil and fried foods in the diet, consume good, healthy fiber involving diet, and then take medications as well, and then be under regular checkup. There are instances where we have refused treatment because the blood pressure has not been under control or diabetes has not been under control. Because until that happens, the result or the response to the treatment is not adequate enough. So, what do we understand by this? I mean, how do you approach these age-related eye disorders? They are to a certain extent inevitable. I won't say. I mean, I don't want to give you a very gloomy picture. We are already having enough of gloomy pictures because of corona and all that. So, but to a certain extent, we are all at risk as we grow older. We are all at risk of developing these problems. But they are essentially treatable only when you come on time. Do not delay the visit. Like I think I told you in our previous Facebook chat as well, that most of us, I mean, most of the people in this age group, they think that it's like we are developing a cataract, so we can go to the doctor 3 months later and get it operated and things. Particularly so during this period of corona, most people are scared to visit any hospital. So they think that, okay, it might be cataract, I will get it checked later and get it operated later. That should not be the approach. Come to the hospital. In fact, most of the eye hospitals, particularly like ours, we are standalone eye hospitals. We don't have other sick patients in our premises. So it's quite safe, and we are taking so many precautions to avoid any such issues. And with God's grace and because of those precautions, for the last 4 months, we have been seeing patients regularly, and none of them have had any issues. So you can feel safe to visit the hospital. First, at least find out what is the problem, why you are losing vision. And I would not suggest you to postpone your cataract surgery either, but that is one option. Whereas the other disorders like AMD or retinal vascular occlusions or or glaucoma or diabetic retinopathy needs an immediate and prompt treatment. So don't delay that. Keep this in mind. Timely treatment is crucial, and treatment is mostly not one time. It's not a hit and run case. You have to be under regular follow-up and be under regular checkups for repeat treatments. And useful vision can be saved in a long time. So it's a long-term relationship. You have to trust the doctors and the hospital and have faith. Should not lose heart because you need to keep coming. "Yen sir, yes sir, how many times should I keep coming? ये तो खत्म ही नहीं होने वाला है." That's not the right approach. See, what is to be done is to be done. You cannot evade or escape the reality. So whatever is possible, let's do it as a team. Let's try to save as much vision as possible. So that brings me to the end of the presentation that I wanted to share with you people. Let's see if there are any questions. We can also, I mean, if there are still any other questions you would want to ask us later, you can visit our website at www.shekarihospital.com. We are also on Facebook, YouTube, Twitter, and Instagram. So, yeah. Let's see. Yeah. So there are a few questions here. Someone has asked, does everybody get these disorders? Not necessarily. I mean, we have seen a lot of these aged people who are quite healthy and comfortable despite having blood pressure and diabetes for 20, 25 years. So there are a lot of these healthy people who don't have these problems. But yes, a significant percentage of elderly people or aging people can have these issues. Can we get back the vision? You can get back the vision in select cases, particularly when you present early. In fact, just yesterday I was comparing two patients who came with age-related macular degeneration approximately around the same time, maybe around 2 years back they have come. So they have had around 72 weeks of follow-up, both of them. One gentleman has come whenever I've asked him to. So over 72 weeks, his vision was around 30%. Now with repeat treatments, he has improved to 90%. And that was his only eye. The other eye had been lost with the same problem. 4 years back, he had been diagnosed at our place only because of suggested treatment. He refused, saying that if the vision loss is inevitable, why should I go for it? But when it came to the second eye also, he panicked. He was literally in tears when he came. So over 72 weeks, over repeat treatments, now he has maintained 6.9 and he's very happy. Every time, even without me asking him, he would come back to me giving me improvements. Sir, earlier I could not even watch the big smart TV. Now I can recognize faces. That was his first follow-up. Then gradually he said, I can watch movies on Amazon and Netflix on my tab. Now he says I can read the small letters also. This was because that gentleman, one thing he was lucky, the other thing was he came to us promptly whenever he was advised to, and he took the treatment whenever he was advised that way. The same similar gentleman, similar age, with similar problems of AMD presented to us, and over 72 weeks, his number of visits have been lesser for whatever reason. I don't blame that patient, but his visits have been almost 40 to 50% lesser when compared to the first patient. And unfortunately for him, from around 60%, he has dropped down to around 45%, 45 to 50%, despite treatments. So, as I told you, we can get back the vision if you come early and remain with the treatment for a longer period of time. The next question is how to prevent these disorders. I mean, the ideal thing would be to go back in time machine and become younger. But since that is not possible or possible only in the movies and fantasy books, let us not talk about that. The best way to do it is start screening yourself. I mean, if you have elderly people who are suffering from such disorders at home, you would realize how significantly it affects their quality of life. So if they are there, at, at a very early age, like it's at 40, 42, 43, whenever you start having reading glasses, that is the time you start screening for these conditions. And from then on, as and when the doctor advises, you can keep getting the relevant tests done, investigations done to confirm the problems, and then probably take it forward as and when it happens. And the next question is, should I take this treatment throughout my life? Not necessarily, like I told you. If you come early, like I said, a stitch in time saves nine, an injection in time saves nine. Instead of taking multiple injections and still not getting the expected benefit, if you come early with fewer treatments, fewer injections, we can save a lot of vision. And are these disorders hereditary? Not necessarily, they are not hereditary. Most of them are age related. So I don't consider them as hereditary, but similar environmental factors. And if there is someone in the family who has had a problem, maybe the risk is a little bit more when compared to others, but I don't think it is hereditary. And what is the best stage from which we can screen for these illnesses? The best, as I told you earlier, at around 40 years of age, when you start having reading problems, that is the time that, in fact, any patient who visits an eye hospital like ours, we always screen people for these conditions, most commonly for glaucoma, for retinal disorders, and cataract, without anyone asking us. If there is a risk, we would have told you that, see, you are probably at risk of developing this, so a few tests will have to be done. And based on those tests, if you're still in the borderline or the risk is lesser, you need to still keep coming back at timely intervals and get it tested for screening purposes. So screening is a procedure where you detect the disease before it actually starts showing symptoms to the person himself or herself. So that you need to trust the patient, trust the doctor, because at that point in time, you might still not have any complaints. So we have picked up many people uh, at an earlier stage and been able to save their vision uh, to a very, very great extent. So it is going to be a long-term relationship, like I said earlier. And I hope, as we have developed our relationship status with many of the patients, we have been successful in saving their vision. So I would urge everyone to get their eyes screened at the appropriate ages. And whenever there, unfortunately, there is a problem, please get the prompt treatment at timely and regular intervals. Thank you very much. Have a good day and stay safe.